Assalamu alaikum and welcome to the Dr. UT lectures. Today's discussion is about the common cold, and a point will be discussed to tell you people about the difference between the common cold and flu. Along that, we will tell you a tricky point regarding the flu, rhinitis, and colds. What is the basic difference among them? Well, we may discuss that in another video. For now, you have to concentrate that we are going to discuss with you guys common in easy words and easy understandings. Okay, so well, the very first point that for our discussion will be, that is the introduction. We will introduce, then we will talk about the pathogenesis. After that, we'll talk about the sign and symptoms, and then we'll talk about the treatment. Okay, well, so the very first point regarding the introduction. So this is actually infection that is caused by the virus. Okay, remember this point very well, that this is actually viral infection, not a bacterial infection at all. Remember, guys, most of the upper respiratory infections, approximately 95% to 96%, according to some texts, that they are caused by the viruses. If you are giving the antibiotics in the treatment protocol, you are actually committing a very big mistake. You are losing the antibiotics. You are making the resistance of the antibiotics. Why? Because it is not indicated. It is not supposed to be indicated in the upper respiratory tract infections. Why? Here you got common cold. It is caused by the virus. Why you are giving the medicine that is going to fight with the bacteria? It makes no sense. Well, so here we have infection that is caused by the virus, mainly known as rhinovirus. And there are certain other viruses that are responsible to cause common cold. The very prominent one is rhinoviruses. Well, if you talk about the adults and children, this is their expression, how many times a year they can express. Regarding adults' point of view, it is believed that they can express 2 to 3 colds per year, okay, common cold. Whereas children less than 5, they have so much interaction and no any sort of hygiene, so they may get 12 colds per year. That's the point to be remembered. So now let's come to the pathogenesis. What is the pathogenesis of the common cold? Very simple. A small dose of this virus, this will reach the eyes and nose. As they reach, they will interact with the mucous membrane, from where they will be forwarded to a point where they will release the inflammatory mediators in the body. Those inflammatory mediators are actually responsible. Those inflammatory mediators are actually responsible to cause you sneezing, rhinorrhea, scratchy throat, dry cough. Peak is actually about 3 to 5. Okay, these symptoms will take about 3 to 5 days, and they will take you to the peak level of discomfort. Then it will go a little bit subsided, and then it will last for about the 7 to 13 days, or you can say 2 weeks approx. Okay, so these are actually the symptoms that are actually observed, the signs and symptoms with the common cold. As this virus interacts with your body, a small dose of this virus gets reached to your eyes and nose, where there is a mucous membrane. With that, they interact. Then they start releasing their inflammatory mediators, and they just within 8 to 12 hours they will give you these signs and symptoms. This is actually a slow process. Okay, if this particular process with some other worse conditions like pain in the body and blah blah blah, those other symptoms they are actually seen, and very quickly they are seen. So you are supposed to believe this point, that they are actually because of the certain other agents, and that is actually flu. That is not the common cold. This is the very point that actually differentiates the flu from the common cold. I hope you got. If you have not gotten this point, I will tell about the flu in the next video. Along with, I will talk about the rhinitis in the next video. So this video is actually about, this video is actually specifically for the common cold. Okay. So these were the signs and symptoms because of what? Because of the inflammatory mediators. Now let's come towards the treatment. I told you in the beginning, this is actually the viral infection. So if you are going to treat it, you can, but it is actually a self-limiting infection. Okay, this subsides within 2 weeks. This is a very longer time. Anyways, if you are not having a rest or fluid intake or humidification, so these may take you to a little bit more discomfort. Okay. Well, so treatment point of view, we have two: non-pharmacological and pharmacological. Regarding non-pharmacological point of view, if you take rest, means you are supposed to take adequate rest, and along with that, you are supposed to do the intake of the fluid. Enough fluid intake and humidification should be around you. So then your condition may subside. Okay. Then we have pharmacological. The guys, they say that we don't want to tease the body, means we are supposed to go for medication. We want to treat ourselves through medication. So they are actually doing a little bit mistake. Anyways, this is self-limiting disease, so you are supposed to give your body a little bit time that please repair it. subside the condition. Okay, so if you do these things, you will get okay. Anyways, those who are actually in search of medication, treatment, and a quick response, they can go for the medication. Pharmacology, we have different medication. We will do symptomatic treatment, and remember, guys, the very important point that is supposed to be remembered is dose. If you are a kid, if you are an adult, and whatsoever is the chain between the neonates to the adult, you must concentrate the proper dosage. If you are taking the rough dose, that may lead you to further discomfort. Okay, so ask your physician and pharmacist. First of all, diagnose it through the physician, or it is an early condition a pharmacist can diagnose. And further, when there is actually complication regarding the dose point of view, then the pharmacist are expert of the doses. You can consult them. So regarding flu, rhinitis, and colds, they are all different. So for that, you have to watch our next videos. Till then, that's all. Thank you for watching Dr. UUT lectures.